Hello, everybody. This is Gary. Today is January 17th, 2022. It's 6:15 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today was an okay day. I have less physical pain than I did before in the past couple of weeks. Rochester, New York got hit by a snowstorm last night. It was difficult to get outside and exercise. So I did an 1 hour workout indoors on my exercise bike. I did outside though today to pick up my prescriptions at the pharmacy. I had to pick up a new acid reflux medication and also an older prescription renewal for Seroquel, which I've been taking for several years now, and will probably continue to take. I had with Seroquel are I'm pre-diabetic and I'm overweight because it increases my appetite. So I have to concentrate on changing my diet to lower my cholesterol and blood sugar and to lose weight. I have to watch my diet more carefully. Um, Everything's going pretty good today. My hallucinations are not that bad. My paranoias are not that bad. My depression and anxiety are not that bad. My fears are not that bad. My paranoia and my delusions are present but under control. Um, Overall, I've had a pretty good day. Feeling a little isolated because it's cold and snowy. No one wants to go outside because we got like 6 inches to a foot of snow over last night. Even though yesterday was a bright sunny day, we got hit with a snowstorm. Um, it's hard to get around when there's so much snow on the ground. Of course, there are worse places than Rochester, New York to have snowstorms. At least we're not in the mountains and getting 20 feet of snow. Um, Tomorrow, I have group therapy scheduled at 2:30, and I plan on going. I signed a contract to go to psychotherapy group and not miss more than 2 sessions of the group. So far, we've only had one session. Last week's session was canceled because the therapist that runs the group couldn't make it into the office. But as far as I know, group tomorrow is still scheduled, and I'm planning on going. Um, on the 20th, I'm seeing my therapist. And on the 21st, I'm seeing my primary care nurse practitioner to go over the progress in controlling my physical pain. They put me back on Neurontin to help me control the physical pain because trying to withdraw from it caused intense physical pain. It felt like my whole body was on fire. My nerves, my muscles, and my joints hurt really bad. Um, and some of the medications that my doctor wanted me to take, the insurance company wouldn't approve. What they did approve was Flexeril, which is a muscle relaxant to prevent painful muscle spasms. I'm also taking extra strength Tylenol for the pain of my joints. I can take NSAIDs like aspirin, Aleve, or ibuprofen, or Motrin because I have a history of stomach bleeding when I take those kinds of medications. So I'm sticking to Tylenol for the physical pain in my muscles and my joints. Tylenol does carry a risk of liver damage if you take too much of it. So I strictly stick to the amount that's prescribed to me. Tylenol helps to some degree, and the muscle relaxants help to some degree. I think maybe my exercise has helped ease some of the pain in my legs by strengthening my legs and muscles in my legs. Because up until a few weeks ago, I haven't been exercising at all. That's how I got overweight. That's how I got high blood sugar. That's how I got high cholesterol. That and a poor diet. Poor physical health aggravates psychiatric symptoms like hallucinations, delusions, insomnia, anxiety, depression, and paranoia. So it's important for me to lose weight and bring my blood sugar and cholesterol under control. I have quit smoking cigarettes. I'm still using nicotine lozenges indefinitely, it seems, because I'm not ready to stop using nicotine altogether. I just don't want to smoke cigarettes anymore. I did go to the emergency room yesterday morning at about 4:30 in the morning, and they let me go around noon because I had bleeding when I was urinating. Blood was coming out. They did some tests, and they said I didn't lose a lot of blood, and the bleeding seems to have stopped. But I did go to the emergency room yesterday, and I went to the emergency room last week because I slipped and fell on ice and fell on my left knee, and they had to x-ray my left knee to see if there was any fracture or dislocation of my knee joint, and there wasn't any damage. There was some inflammation, but that's true of all my joints. I probably have arthritis, which is causing some of the physical pain that I have. Going back on Neurontin seems to have alleviated at least some of the physical pain that I was experiencing. And of course, physical health, physical pain, and psychiatric symptoms are all interconnected. They make each other worse. When I'm under stress, um, that increases physical pain. And of course, physical pain increases stress. And then it becomes a vicious circle. So that's all the report for now.